Hi everyone, this is Damaris and today I'm going to be presenting my patient case report. I will be using the fictitious name for the patient to protect patient's privacy. She is Mary, a 24-year-old female Caucasian. She lives with her boyfriend and has two children, ages 2 and 5 year old. She came to us for assessment and medication management. So her chief complaint included that, in her own words, I cannot keep my job. I'm feeling very disconnected from things. I had a recent manic episode. Also stated, I need medications for my safety and the safety of others around me. Um, so, the history of her present illness included a long history of trauma in childhood, which included sexual, um, psychological trauma, and also physical trauma. Uh, also, she does have a long history of using controlled substances such as LSD, cocaine, and currently she was using cannabis. She reported using it every single night, as this helps her to sleep. Um, also, she reported having depression, which comes and goes. Um, she was experiencing panic attacks, and this was occurring frequently, a couple times a week. Mm. Her current medications she was taking included Adderall XR 10 milligrams every day. She mentioned that this medication was prescribed to her by an online provider. It wasn't very clear as to how she got or how many she got. She said she was running out. She didn't get any refills. Also, was taking clonopin, 0.5 milligrams, as needed. And according to the patient, she was provided this medication by her OBGYN. Her previous medication history, which the patient did not recall well, but the only two that she recalled was the Abilify 5 milligrams, which she was prescribed to take every night after she got discharged from the hospital back in April of this year. And she also mentioned getting medications couple times when she was also admitted at the hospital, but that was in 2016 and 2019 in California. She did not recall which medications were those. When she came to us, we didn't have any medical records. We didn't have any medication or problem list for her. So we were just basically going by what the patient was telling us. So her review of system, the constitutional ones, she denied any fever, chills, fatigue, weakness, any weight gain or weight loss at this time. Um, in her psychiatric history, patient reported having been diagnosed with bipolar disorder in the past and recently with ADHD. She mentioned about getting some in her surgical history, surgery for an abdominoplasty and breast implants in February of this year. The patient's history of present illness and psychiatric review of systems. So for her mood, she described it as feeling kind of anxious, a lot of things going through her mind. Also experiencing disconnection from things around her, having many conflicts with the boyfriend. In regards to depression, she said she was okay. Um, mentioned some obsessions. As far as her obsessions, she mentioned having obsession with having the shampoo and the conditioner closed tightly and placed in a certain way. Otherwise, she felt that something bad was going to happen. Um, when she described her substance history, she reported that she had used acid or LSD in the past, and the most recently was when she had the argument with her current boyfriend. In her childhood, as mentioned before, this included lots of trauma, and because of that, she reported having repeated unwanted, disturbing memories of the trauma. And this has occurred a couple times when she was driving. And she also reported having flashbacks of her mom being abused by her stepfather. The admissions that she had to the hospital, she mentioned that couple times um, she decided on her own that she needed to be inpatient, so she went to the hospital and she got admitted. Um, she denied currently using any drugs except for the cannabis use, which is something that I learned because I didn't know much about it. According to my preceptor, the patient is using the 2 to 1 ratio, which is a stronger type of cannabis. Um, and that was something I did not knew before. The patient denied having any aggressive symptoms. She reported having eating disorders as a child, and when she was about 13, 14 years old, she reported having anorexia and bulimia back then. Another thing was that she reported about her postpartum mood changes. She reported, I had psychosis after having my first child, and that was one of the times when she ended up going to the hospital. Um, as far as her hypomanic or manic episodes, so she endorsed that back in April. She all of a sudden woke up not feeling in love with her boyfriend anymore. She felt had no feelings towards her children. Um, she was kind of confused about who she was. She will be doing things and not knowing why she was doing them. She felt very dissociated from everything or disconnected. For her mental status assessment, we did review, and so her affect was bright and well engaged. Appearance, she was casual, dressed appropriately for setting. She was wearing a wig because she mentioned when she had the manic episode, she decided to cut her hair and shaved it, so she had no hair, and therefore she was wearing a wig. Her grooming and hygiene were appropriate. Attitude was calm and cooperative. Her behavior was polite. She had good eye contact. She was sat still on the chair. We didn't notice any psychomotor changes or unusual movements. Um, at this time, she denied any suicidal ideations or homicidal ideations. Her insight and judgment were fair. She was had a concentration, short-term and long-term concentration were intact. Her perception of things were okay. She denied having any auditory, olfactory, or verbal hallucinations. Her speech was normal rate, tone, and volume without pressure. Her thought content didn't include any delusions. Um, Her insight level was good. Judgment was adequate for safety needs at the time when we saw her. She was able to recalled, I'm sorry, 3 words immediately, and she also recalled them after 5 minutes. She was able to do simple calculations. She recalled the current president and the previous 2 presidents. She was able to identify the similarities and differences of 2 different objects. Um, and for her risk assessment, so again, she denied suicidal ideation or homicidal ideation. However, she did have a history of suicidal ideation in the past, according to patient. However, her protective factors included her children, her family, and friends. I think this case was very interesting. However, given that she came to us with no medical records, she came on 2 medications, but we didn't have any record of that either. The only diagnosis that we could give her at that time was the PTSD, post-traumatic stress disorder, given her previous trauma history. We One of the things that I learned here about as far as diagnosis, you do not have to have a diagnosis in the first appointment. It's important to dig for more information and to get the medical records or labs or whatever else is needed. So the plan for her was for her to get additional labs like a TSH, CMP, AUDS, vitamin D. We were also planning on getting the release of information for obtaining medical records from the admissions to the hospital. And another important thing that I learned here was that my preceptor was going to be obtaining a dissociative experiences scale at the next visit. And so that will be a series of questions that we will be asking the patient. And based on that and on her history and her assessment, we were going to find out if she met criteria for dissociative disorder. Also, the plan is for her to get an adult ADHD self-report scale assessment. I don't know if this will be done at the same visit, but the hope is to do more visits with the patient. Another thing that I learned was the importance of listening. She had a lot of information to provide to us, and it was very interesting to hear everything from the patient and not to be interrupting her every time, because even though we had an agenda to cover, she mostly covered everything by telling us her story. We did have to obviously ask questions to direct the interview, but she was pretty good at giving us information, and I feel like we were pretty good at listening. Another thing that we offered to her in the meantime was for therapy, and she agreed to it. She said she had never had any therapy. So the plan was to get all those records and to see the patient in another session in about 2 weeks. So again, the only diagnosis we were able to provide was the PTSD, given that we don't have more information about those admissions or about those provider appointments. So looks like we have a lot to do still on this patient in order to continue with providing any further diagnosis. So if you have any questions, feel free to ask. I know there is a lot I might have not covered, or maybe there's a lot that I covered. Feel free to ask any questions. And thank you for watching this.